Well, hello and welcome to the Pregnancy Help Podcast. My name's Christine Grimmett, and I'm joined here by Betty McDowell, Vice President of Ministry Services here at Heartbeat International, and Tracy Winsor from an organization called Be Not Afraid. So October is National Pregnancy and Infant Loss Awareness Month, and Be Not Afraid really just ties into that. So we invited Tracy to come and share a bit of her story and her ministry work with you. I'd like to mention that we have more trainings available through Heartbeat Academy on a variety of pregnancy-related topics, including topics like difficult prenatal diagnosis or pregnancy loss and how to best serve clients in those situations. So if you're looking for some training in that area, I just want to encourage you to go to heartbeatservices.org and click on store, or you can contact the Heartbeat office, and we'd be happy to offer some guidance on where to start with training. So Betty, would you like to start us off?
Happy to. Thanks so much, Christine. We want to take this morning and just really dedicate this podcast to those who have walked through loss or perhaps are walking through loss right now. Our hearts are with you. Our hearts are for you. And it's really just a neat opportunity for us to take this time and to have a few minutes really with Tracy Winsor. And Tracy and I have just been kind of getting to know each other. She is a pretty amazing woman, and I think that you'll enjoy hearing a little bit about her story and really the birth of Be Not Afraid. So Tracy, would you go ahead and just maybe give us a little introduction and talk to us a little bit about Be Not Afraid?
Certainly. I thought that I had a plan for my life, which was that I was going to be a career woman. And then unexpectedly, our first baby ended up in NICU. And when I was discharged from the hospital and he was not, I looked at my husband and I said, if I get to take this baby home, I can't go back to work. And that really was the beginning of a large family, as well as a lot of volunteer work in maternal child health. And I took my education and I just applied it to really church ministry around loss and young family ministry. Subsequent to that, I've had 2 losses myself, and I was working in something called Elizabeth Ministry in my parish level when I met my co-founder for Be Not Afraid. She was a woman who had had a prenatal diagnosis herself, a baby with trisomy 18 who was stillborn at 32 weeks. And we were happy together to build a really good loss ministry at our parish. But we found one year that there were 2 families that did not find the support that they needed. And both of them had a prenatal diagnosis. One family ended the pregnancy without having adequate support and information at diagnosis. The second family carried to term, delivered a baby that they needed a lot more information about how to handle that baby at birth, did not get the information that they needed. So we decided that God maybe was asking us to find someone to provide some kind of service that would support families with a prenatal diagnosis. And so we spent about a year knocking on doors. We discovered a medical model of care called perinatal hospice. We thought, gosh, there's got to be a doctor or a hospital system or a hospice organization that would be willing to provide this in our community, which was then Charlotte, North Carolina. And at the end of that year, we got as far as having a perinatal hospice roundtable with all the major players that might be part of a community-based response, and no one wanted to do anything. So we looked at each other. We're not really sure which one of us said it, but we thought, well, maybe we were mistaken. And in fact, God's asking us to do this ministry. It seemed like a really bad idea. But we were pretty sure that if we didn't at least try, God probably would not let it go. So we stood still for maybe a month or so, and sure enough, we had another parent with a prenatal diagnosis, another family that also ended the pregnancy because there wasn't sufficient support for her. So we decided that we would build something. We did not think that we would get any referrals. It took us about 6 months to a year to get our first referral. And we were still pretty sure that the medical community would not respond positively to, we always identified ourselves as a couple of wacky pro-life Catholic women. But I had a background in public administration, so I knew how to build a viable ministry. We had a manual. My co-founder is a CPA, so everything looked right. And at our first birth, which ultimately ended as a stillbirth at 32 weeks because baby was very frail, there were three of us that were there supporting mom through the night as she was laboring. And I went on a hunt at like 2 or 3 a.m. for a cup of coffee and found myself out at the nurse's station. And one of the nurses said, I need brochures or a business card for you all, which we didn't have, but I need something from you all. I didn't realize you were a service. I just thought this mother had the best friends in the world.
It's so
And
sweet. That
I
is so
thought,
sweet.
this is how this works. Who knew this is how it's going to work? So that was really our beginning.
I love that. So I hear you were using this term, prenatal diagnosis. So I wondered if you could maybe clarify that for our listening audience. What do you mean when you use that term, prenatal diagnosis? Because I know I've heard other terminology used.
It used to be that we would say a poor prenatal diagnosis. And a lot in the disability, a lot of individuals in the disability community have objected to the word poor. So we at BNA have just adopted prenatal diagnosis. Sometimes you'll hear adverse prenatal diagnosis, difficult prenatal diagnosis, as Christine said. So there's a couple of different ways to refer to it. Most often when people think about poor prenatal diagnosis or prenatal diagnosis in a service of care, they're thinking about perinatal hospice, which is the service model that we started with. With Be Not Afraid, we've always supported parents without regard to what the expected outcome was for the diagnosis. So with perinatal hospice, it's generally the idea that the diagnosis is serious enough that maybe you're looking at a baby who will die at some time after birth, shortly after birth. We were accepting referrals whether the diagnosis was Down syndrome or a heart defect where parents were going to continue the pregnancy and have a heart surgery, or whether it was a more serious diagnosis like anencephaly that might be a more appropriate referral for a perinatal hospice provider. So it could be a structural anomaly, it could be a genetic syndrome with an intellectual disability. It's just a wide variety.
So Be Not Afraid is what I'm hearing is really a larger umbrella. So it's when we talk about perinatal hospice, that's more specific. So that fits under your umbrella, but your umbrella of care is much wider than that. So when you use the BNA, Be Not Afraid. So for our listeners, when you're
Yes.
hearing BNA, it's Be Not Afraid. Tracy, your calling, really what you described as a calling that God put on you. Never thought you were going to be doing this. And we hear that over and over again, particularly in the pregnancy help community. In fact, we were discussing this the other day. It's like, have you ever met someone who said, someday I'm going to be a pregnancy center director? Or I'm going to head an organization to walk with people through the toughest time of their life. And we don't hear that very often. I think that maybe on occasion that comes up, but you remind me so much of the way people get that calling from God to do really the impossible or to do the very difficult, and that's really what you're doing with Be Not Afraid now. And in our conversation in past, we've talked about the really exponential growth. And so I wonder if you can maybe share with us a little bit of, you said this was in Charlotte, North Carolina. From those very beginnings, those small beginnings in Charlotte, North Carolina, where are we now with Be Not Afraid? And maybe tell us a little bit about what you want the future, what you believe God's called you guys to for the future of Be Not Afraid.
Absolutely. You know, we started out small and we had that first mother. I think it took us another 6 months to get another parent. And in our early years, maybe it was 3 families a year. Initially, we were a peer ministry. Over time, we realized that the needs of parents were so complex that it required a more complicated approach to support than peer ministry. We made that transition. Over time, we garnered some attention in the national Catholic community. We involved ourselves in ethics conversations in the Catholic community nationally. And so pretty soon people were coming to us nationally, both to ask us to support them in development of peer ministry in local communities elsewhere, which we did. But we also had parents coming to us looking for support in other places outside of Charlotte. And our motto had always been that we would serve whomever God sends. Initially, we would try to find some other local service that we could refer people to if they came to us, say, from California. But our service model was rather unique in that we were accepting parents without regard to the diagnosis and that we were connecting at the diagnosis. Sometimes when you have hospital-based services that are perinatal hospice or perinatal palliative care, as you said, there's a specific kind of diagnosis they're looking at, and they want to connect with parents a little bit later in the pregnancy. So ultimately, we found we were serving more and more parents nationally. This year, I think our number of parents served or families served will be closer to 70, which is actually a large number for a service like ours. Most of our families have been in California this year. I think I'm safe to say we've served more families in California than in North Carolina. We also realized over the last couple of years that it's actually much easier to serve parents in other states than it is to raise funds in other states. And we recognize that the rate of growth is something that we can't sustain. We don't feel called to building a national organization. So we really stood still and discerned over the last couple of years as these numbers of parents kept increasing and thought, okay, what is it that God is asking us to do now? And it seemed like the best option for us would be to train other organizations to provide the care that we provide, both in terms of connecting with parents without regard to the diagnosis, connecting early at diagnosis, which is a really good approach for pro-life organizations because we want to connect with parents when that decision about abortion or carrying to term is being made, and then help those organizations be providers in their local communities. So that's what we're working on now.
That's great. We know that there are some organizations that exist that are really kind of newer in this field of really helping folks, helping families with pregnancy loss. We've seen this topic come up more and more in the pregnancy help community, those serving in pregnancy centers and medical clinics, wanting to be more equipped to help particularly moms who come to them and discover that they have a prenatal diagnosis. And so this is something that Heartbeat has certainly been interested in. And so I know that as time goes on, we'll be sharing more information of opportunities through our academy for people to get training. And then at our 2022 conference in Jacksonville, Florida, coming up at the end of March, you'll be there with us and you'll be providing really an all-day training, an all-day opportunity for people to understand this issue more, to be able to walk with women through women and families through this. So as we see this fight in our culture for the value of every human life, particularly those who are so innocent in the womb, we do believe that as we see a cultural shift, a revival perhaps of sorts on the issue of the sanctity of human life, that this will become even more necessary, needed, embraced, wanted to help families. I know that as a social worker in past, I've read some things, more like a white paper or two, on the topic of what it's like, that whole grief process for someone who has a prenatal diagnosis and who walks through and the grief, the birth, the grief, and how family can join in. And it becomes something that the entire family maybe experiences together, and that might be extended family, and what this can do for really a whole community. And it to me brings back thinking of losses that I'm aware of and how that precious, tiny little life made such an impact in such a short period of time. And yet we also know that it's a common practice from the medical field for a doctor to perhaps suggest, advise for a woman to go ahead and have an abortion in that pregnancy. Some of them thinking with good intention that this will lessen the grief for this woman by making this just go away. And yet we find, in terms of what I've been reading, that it is so much healthier, very, very difficult, but so much healthier to be able to walk this child to perhaps their first and last breath of life, or perhaps as you mentioned with your first situation of a stillbirth, and what that can do for that family. So as we we're looking forward to all the things that we'll have to offer in terms of really equipping pregnancy-centered, really keen leaders. Also, just making people really aware of this particular issue, because I do know that there are times whether a miscarriage or a stillbirth or something else along the way that the tendency is to just let's just move past this. So I would be remiss to not take time with you, Tracy, and have you really talk to us about some practical things. How can we look at this particular challenge, this particular sorrow, and how can we be a blessing in understanding and in walking with somebody through a prenatal diagnosis?
I think that certainly with respect to a prenatal diagnosis, I think that one of the really important things, and one of the things we hope to do when we provide coursework for you all at the Academy, is just to increase, in a sense, the toolbox that you all have of knowledge to approach prenatal diagnosis. Um, we find so often that testing lacks a certain level of informed consent. Oftentimes, parents are being advised to terminate around testing that's a screening test and not a diagnostic test. So there's that. Very often, parents aren't aware of the trauma associated with a prenatal diagnosis. Oftentimes, parents aren't aware that lethal language may have been applied. So, to a diagnosis that really can't be determined to be lethal prenatally. So, the reality is that stepping into the moment, making time to listen to someone, understanding the full scope of the story of their diagnosis. Again, oftentimes those stories will be related in a way that's very consistent with. I hate to say it, it's almost like a shark attack story. We went in to have an ultrasound. We were going to find out, boy or girl. It's all happy until suddenly it isn't. And then helping people understand that there's not a need to act quickly. There may be more information, and there is support. We have great research that was done by Dr. Byron Calhoun many, many years ago that said that 80% of parents will terminate if there's a serious prenatal diagnosis. But when offered a service of comprehensive supported diagnosis, 80% will carry to term. So certainly what we know within this population of parents is that most parents who abort around a prenatal diagnosis want a better option. They just were not given that opportunity. I think the other thing that's important around prenatal diagnosis for us as a pro-life community is to recognize that almost all efforts to advance abortion access are based on prenatal diagnosis. So when we look at like the push to legalize abortion in Ireland, it was almost entirely based on the backs, as it were, of children with prenatal diagnoses that are characterized as lethal. So this is such an important area for us to gain competency in. There's such good work that could be done here because parents are so desperate at diagnosis for support. And it really, as you described it, it's beautiful work, even if we're looking at situations in which parents are moving towards a loss. we have medical research now that says that certainly for the mother, there is an emotional benefit for the mother to carry to term, even if that baby is dying, because of the opportunity to parent that child for as long as possible. But it's dependent on having good comprehensive support.
Thank you for that, Tracy. Um, you used some terms with me that I'd like you to explain, and you used the idea of this framework of the avoiders, the advisors, and the advocates. So walk us through a little bit of that, because I think that's pretty equipping as well.
We so often when you are working in this field of young families, even if you're not dealing with someone in the midst of their own loss or in the immediacy of a loss, oftentimes we'll find someone who presents to us with a prenatal diagnosis, or in the case of a pregnancy help center, somebody who's there with a crisis pregnancy, but they have a prior loss that hasn't been dealt with. So I think it's so valuable and important for us to have an awareness of how to deal with perinatal loss, pregnancy loss, or infant loss. And so we talk about in our work kind of keeping in mind the idea of avoiders and advisors and advocates. Avoiders would be the individuals who approach perinatal loss, generally the people around the parent who think, I don't really know what to say, so I'm going to say nothing. And if you talk to parents who've had a loss, they will say, I know exactly who you're talking about. These are the people that will scoot out the side door of the church when they see me rather than have a conversation. The people who just want to pretend like nothing has happened. So they see the parent after the stillbirth and don't say anything. Very painful for parents. Advisors are people who are just trying to fill space. Sometimes they're advising the individual who's had a loss based on their own experience. Oftentimes they're talking about how the parent isn't grieving well or fast enough, or what the parent might do to grieve better, or what the funeral should look like. A lot of times they feel compelled to tell the parent what God is doing in their life. So all of these things can be difficult for parents. If we think, I've done so much research now on your love approach. If we think about the love approach, the advisor is not listening and learning at all. They're just talking. So they're saying a lot of things that offer no benefit. What we really want everyone to shoot for is to be an advocate. And an advocate would be the person that understands first that grief is a very personal journey, a very individual journey. I think from a Christian perspective, it's helpful to think of it as a wilderness journey. Certainly within a couple, the couple is going to grieve differently. And it is a unique and stressful time. It can be for a marriage because, whereas if mom loses her mother, it's a secondary loss for her husband. He can be supportive to her. When you lose a child between the two of you, it's a primary loss for both of you. And you both have this wilderness grief journey you have to be on. And it's different for both of you. So the advocate understands the personal nature of the journey. They understand the importance of mourning, which is, kind of the outward expression of your grief. The advocate understands that it takes time. And the advocate isn't afraid to acknowledge the loss. And sometimes that's as easy as saying baby's name. Frequently when we find that we have a parent who's got a prenatal diagnosis, and as we're taking their history, we understand that there's prior miscarriage, we encourage those parents to name those babies, for instance, to change that from a medical event, I had a miscarriage, to giving baby a name. And it's such a powerful thing if there is a name to say that name to parents. And sometimes even just something as simple as remembering to send a card that says, remembering Haley Grace and holding you all in prayer can be so healing and life-affirming for parents. So ideally, we all want to be advocates, not avoiders or advisors. From a practical standpoint, if you are working at a pregnancy help center and a client has a loss, it's hard in these COVID days, but hopefully it'll get better soon. But if you've been supporting a family and they have a loss, I really encourage you to consider getting to the hospital to meet that baby as a practical help. there is something so powerful about knowing that people know your child. And parents frequently will be afraid to ask people to come to the hospital because it's scary to ask people to come to the hospital. But it can be so wonderful to have people just show up. So consider that as a practical help. Second, to those who are going through loss right now or who have had a loss, there's this wonderful saying in bereavement that the children you have lost have a greater impact on you than those that you are allowed to parent. And that is so true. We see it all the time with the families that we work with. And I can say it as a lost mother myself, having had two really early losses, which often, people kind of discount. The miscarriage isn't as impactful as the stillbirth, and the stillbirth isn't as impactful as losing an infant in a month. But even with my miscarriages, Thomas and Gabriel, Be Not Afraid would not exist if not for Thomas and Gabriel. So I just want to say to anyone having their own loss, to know that there is hope. And it's difficult to figure out how to parent a baby from the painful distance between this life and heaven, but it's possible.
Thank you for that, Tracy. And thank you so much for the plug for the love approach. The love approach is really foundational to everything that we do here at Heartbeat International. So LOVE, love. The L is listen and learn. The O is opening up options. The V is giving vision and value. And E, really extending and empowering someone to move forward. And for us as advocates, there probably are some very practical things that we can be doing as well, which would really be being there to listen and to walk through that grief and understand that grief is different for each and every person. And there's no really scripted way to walk through grief and to do some of the practicals, whether that's to bring a meal or perhaps watch other children or just to give that space. So I know I've walked with friends through loss, and I realize that in many ways, time does not heal all wounds. That's kind of something that we tend to think about. And so I love what you said about saying that child's name and giving opportunity, not forcing someone to speak about that loss, but giving that opportunity to just be present for them and allowing them to be able to talk about perhaps the past and to talk about the things that they're grieving of what they would have had in the future. So all of that, very sweet and very, very valuable. Tracy, thank you so much for taking the time to be with us. We admire the work that you're doing. We're thrilled for the journey that you're on and how we get to be part of it. And again, being able to take this particular podcast and really acknowledge in the month of October Pregnancy and Infant Loss Awareness Month. So we hope that we've been able to bring some awareness to those who are listening to us and perhaps some equipping and certainly an understanding of those who are in the midst of grief right now or who've been walking that journey, that we do grieve with you. And we really acknowledge the pain that you have been walking through. And I do think, Tracy, your own testimony of how God took the difficulties in your life and made something beautiful out of that, that we know God can do that for others as well. So it's really been an honor for us to have time with you. We look forward to what's in the future with Heartbeat International and Be Not Afraid. And Tracy, if you could you can close us out. We'll turn it back over to Christine, but tell us the best way for people to learn more about Be Not Afraid. What's the best way to reach you or the best way to learn more about your organization?
The best way to learn more about Be Not Afraid is to go to our website, which is benotafraid.net. And I think particularly helpful, we have a research page there that's organized by topic. So you can find a lot of information that's research-based there relative to prenatal diagnosis. And I can be reached through the contact button there, but my email is tracy.winsor@benotafraid.net.
Thank you both. Thanks to our listeners for joining us for this episode of the Pregnancy Help Podcast. Again, you can visit benotafraid.net if you'd like more information. You can also contact Tracy through that website. And I'll post that link in the episode description. Also, again, if you're looking for additional training opportunities, we have hundreds of courses and growing available on the Heartbeat Academy. So visit heartbeatacademy.org to browse through those courses. Thanks for listening and have a great rest of your day.